child will be died or alive. The effect of the between the 0 and the t. But may now say that no, there is no rule all or none. Say that from the 0 until 8, that's a sensitive. But the most sensitive part is between the 3 until 8. We say that the organogenesis period or teratogenic period means that sensitive to teratogen between 3 until 8 because most of the organs is appear. For example, you know in the 3 week we have a gastrulation, 3 layer in from the first, from the 4 week start to the formation of the upper lower limb and limb bud, heart, for example, and the most of the organs. From the 6th week is the gut, okay, intestine, until the 12th. Do you remember or not? The liver start, the liver bud appear in the 4th week. Yeah. That's why that's between the 3 until 8, and this part is so sensitive to the teratogen. But that's not means that after that there is no effect on the child. Yes, there is. After the 8, some organs are still sensitive to the drugs. For example, the nervous system. And for example, the plate are sensitive to some drugs. So, we have any safe time. Means from the 0 until the birth, there is no safe time, but the sensitive time or teratogen is between the 3 until 8. That's for example, look here. Before that, say that before maybe in the last session, say that between the 0 until the 3, the most that's the days of the embryo may occur. After that, this period is the maximal sensitivity to the abnormal development. Yeah, that's correct now. That's maximal sensitivity to the 3 until 8. Just this part, that's not right now. And after that, as I told you, if you look at the unfortunately got it. Some organs is after that growth and maturation, but there is some small, some minor effect. That's a malformation, okay? Malformation, absent or partial, the partial or complete absent of some organ. The next one is disruption. Disruption means after the formation of the organ, after the formation, we have a morphological changes of the nation. Means that because of the, for example, that's the intestine. Okay, and maybe here because there is no, for example, there is no blood vessel, maybe closed, and here. For example, you can see the atresia means the closing, atresia of the bones. Or this is a vascular accident leading to the bone atresia closing. Or another one is in a disruption is like this. Look here. Maybe some amniotic bonds from the amniotic sac, maybe some bond, some rope, separate, and that's that's come to and close this part. And you can see the amputation of the finger. Absent the finger part. That's formed before that. But that rock, that's a amniotic bands, come around it, and because of the ischemic, finally amputated. Look here, for example, this one. There is a cleft in the leaf. Because one of the ropes come here and make a vascular changes in this area and make it cleft in the lip and in the plate. This is a disruption. Disruption means the morphological changes after the formation of the organ. Before that, no. Absent or partial or complete absent. Here, after the formation, we have a disruption. Yes. Deformation. Deformation means morphological changes, but because of the mechanical factors, means of the pressure. Look here, that's the leg, okay? Or the foot maybe, that's a, you see some people have a leg, we say the club foot, yeah? That's because of the pressure inside the room changes the morphology of the organ. But it's reversible. We can fix it after the birth by the rehabilitation or surgery don't need surgery because just morphological. Yeah, but by practicing by the physiotherapy and by the occupational therapy and reversible after the birth. What happened, for example, you know, the fetus inside the amniotic cavity, inside the amniotic fluid, floated, okay? When we have a small water, the pressure starts to the organs, like this. That's a food, that's another one. Through here, that's not normal. The fourth one is syndrome. Syndrome, you know. Yeah, some of the sign appears with the special cause. Yeah, you know this, for example, the syndrome of Down syndrome. You know that because of the chromosome, abnormality chromosome 47 and the trisomy 21. That's the syndrome. That's some of the abnormality appear together with the specific common cause. But the next one is association. Some of the signs appear without any special cause. You don't know why happened. They appear with each other. For example, Vector. Vector V means the vertebral defect. Anal atresia, close that part. Cardiac. Trachoesophageal means that because at first the trachea and esophagus is a one tube, and the septum divide to the trachea and the esophagus, maybe? Yes. Yes, in the behind it. Yeah. But the defect of the trachoesophageal septum maybe make a problem. The renal and limb anomaly. They may be happening with each other, but we don't know why. The VAC term is association. As I told you, a part of the defects is because of the environmental factor. Let's come back to the 1940s. Okay, in the German, a physician discovered that the rubella, kind of the virus, made a spot. I don't know in that's the measles. That's a German measles. It's different with the measles. It's a German measles rubella. In a Farsi say that the sorge, but the measles is so hard. I don't know. That's because the Farsi is not Arabic. I don't know. And as I told you, some people, some mothers, when they use it, thalidomide, that was a drug for that's a pill that's used for the headache and sleeping. Yeah? Mm-hmm. And these drugs, as I told you, that's for the morning sickness, because I have a headache. The child was born with the accent of the upper. And after that, that was banned in 1962. And they think the environmental factor is so important. And the mother have to don't take a drug. You know, most of the mothers use drugs during the pregnancy. That's normal. But have to control it. And have to consult with the physician.
What any treatment of
There's a very important effect on the embryo related to the dosage that the mother takes.
Yes.
I mean, how the amount of pills she takes.
Yes.
So more dosage, more defects.
Yes, maybe. Tools, some principle. The first is the susceptibility to the teratogenesis. The genetic is important. For example, I use from the one pill, this mother with this mother is different. Because some people, maybe the genetic is strong and can metabolize that drug. And some mothers, the genetic is different, is not that's not able to the metabolism. Okay? So the genetic is important, the maternal genetic. The next one is a critical period. Means that the time of the exposure to that period. How long take that drug? For example, that's the X-ray is so harmful. Yeah, you know, there's people who the radiologists. The radiologists they go to and they have something that shows the dosage of the consume of or exposure to the X-ray. Yeah, how long? For example, one pill is not effective, maybe, but for the 3 months is so effective. So the time is so important. The dose, and also the critical time. The critical time is in which age of the age of the embryo. As I told you, between 3 until 8 is so critical. And after that, it's less than, but less than the 3, between the 3 years. But as I told you, there is no stage of the development is completely seen. If you look at as I told you, the dose of the drug here, for example, it's between the, that's not correct, okay? And now it's not correct, because as it said that before, that between the 1, 2, and 3, that this, they think in this period, all the embryo is dead, okay? And after that, look here, for example, it's between 3 until 8, the neural tube defect is mental retardation. And after that we have some, for example, the plate, the ear, or something like that, that's a functional. Here is a major congenital anomaly, that's a critical area, critical stage. And after that, most of them are functional. As I told you, the dosage and the duration of the exposure is important. The next one is that's not important. There's a specific way that's pathogen act on the baby. That's maybe say that maybe that's a biochemical and molecular process that's make a cell death, decrease of the proliferation and the other cellular phenomena, and that's a manifestation of the abnormal development or this malformation means that the appearance of that effect. Yeah. Growth retardation and functional disorder. So the first is the genetic is so important. The genetic order. The critical period is important. Is between the 3 orders. The time of the exposure is important. After that, the mechanism. After that, that's means that you can see the abnormality. Maybe that's this. That's a mental retardation. That's a functional disorder. Maybe we have malformation. That's the oldest principle of the pathology. But what's the environmental factor? The first is the infectious agent, like a virus. For example, the Zika, do you remember in a 207 or 208 in the Africa, some baby was born with a small head. Yeah, Zika virus. The physical agent, like a fever, hypothermia, like a gamma ray. Okay, for example, in the Chernobyl, and that's exposure to the gamma ray, X-ray. Some drugs, for example, the alcohol. Yes, that's X and cocaine. That's cocaine. The grass and all of them are harmful for some hormone. For example, the mother practice the bodybuilding and maybe use from the drug testosterone. For the mother is that's so harmful. Let's say in vitro fertilization. In vitro fertilization, that's a process. That's the mother or father have a problem in a normal way. Okay? They use from the in vitro fertilization. When it goes to the clinic, and the sperm and oocyte come, that's in the media, yes, fertilize, and after that transfer. But this is not malformation. This is just that's a behavioral things. For example, some of them maybe have a schizophrenia, or it's most behavioral. The maternal disease, the nutritional deficiency, okay, maybe mother the deficiency of the, for example, folic acid.
Folic acid.
Yes, the folic acid.
If mother not take treatment folic acid, the problem of
Yes, yes. Now the mother consume it,
yes.
and every day have to consume and take the pill of the acid food.
Problem system nervous.
Because that prevention of the neural defect. Yeah? And male-mediated teratogenesis. Male. What's the relation between the male and female?
Vitamin D, vitamin A.
No, the male. For example, I'm a man. My wife? Yeah, but the teratogen, maybe someone is working in the male. Okay? In the male working and come to the house with the rest of the male. This is might maybe bring something to the bed, and that's maybe transmitted to the female. That's they have to be careful. I told you, for example, the virus, the rubella, cytomegalovirus, herpes. Herpes is just here maybe because of the infection appear. That's a simple herpes. That the simple herpes is, most of us we have a herpes simple.
Herpes.
That's some. That's a bit. That's make some abnormality in the baby. Varicella virus and AIDS. Yeah, HIV. You can see here some of the virus, syphilis, for example, mental retardation, and deafness. Toxoplasmosis. The toxoplasmosis is so interesting. Hydrocephalus, cerebral calcification, and microphthalmia. Microphthalmia is a small eye. Okay? What happened for the toxoplasmosis? Say that the mother are pregnant, please don't keep the cat in the home. Because, look here, the toxoplasmosis gonadai is transmitted to the mouse. And the cat eat the mouse. That's in the house, it's transmitted to the mother, and maybe effect on that. And maybe abort. And this. Yeah, that's the physical, as I told you, that's physical, for example, hypothermia. Hypothermia, that's a fever, that's a fever. As I told you, another one, the radiation, X-ray, gamma ray, as I told you, the explosion and the atomic explosion in Hiroshima, and there's the destruction of the reactor in Chernobyl. Hiroshima, that's a gamma ray. At the Chernobyl, that's a gamma ray. The gamma ray is so harmful that used for the treatment of the cancer. Okay? But the shield means that we have a thick
barrier
for the sheet, just exactly in one point used for the treatment of the. But when they goes to the that's a so good film, and the people they are going to the bridge, just Musayyid. Do you remember this sign in Arabic? Yes, I mixed with Farsi. That's exposure to the, for example, for the see the Chernobyl, what happened for the reactor. That's all of them. That's exposure to the gamma ray, and finally they take cancer because of the mutation in a somatic cell. And the most, the X-ray, for example, make it a microcephaly, this is a small head, a small brain. A spinobifida like this is a bifida, means the vertebra is not complete, and some part of the spinal cord exit from this area. And that's I don't want to memorize them, but you have to know the, for example, the virus is environmental. The chemical, look at the chemical, for example. Thalidomide is one of the defect of the limb and the hormone formation. They have a Caesar. I think that's a sound. تشنج.
Caesar.
نوبة.
تشنج. In Arabic it is تشنج.
Yes.
شنو الجواب؟
As a seizure. That's a,
No.
for example, valproic acid they use. That's a schizophrenia, for example, use the lithium. That's a heart malformation in the baby. Amphetamines, that's the drug. And anticoagulate, warfarin after the ischemic, MI. Cocaine, alcohol, industrial solvent, organic, mercury. That's this, mercury, GV. Yes, Arabic, GV.
زئبق.
Because the industry is something that's entered to the sea, and you know in Japan we use the fish, and the concentration of the mercury inside the fish increase, and they approve that the mothers that consume the fish with the high mercury have a deficiency in the neural system. And the lead, before that the gasoline was a lead in the pollution, air pollution. That's one of the charts we use from the Hidatian syndrome. Look at the eyes, the ear. That's 100 is the mental retard. And look at the fingers, malformation in the fingers. Alcohol. Mothers consume alcohol. Yeah. The distance between that's a fetal alcohol syndrome, the short palpebral fissure here, the distance between the eye. Here is a filter. The depression in this area is a filter. Well, look at that's the absent of the filter, and look at the thick superior. That's a mental retard. That's the fetal alcohol. And so I have told you the hormones. Another thing for the maternal disease, diabetes of the mother, PQ, that's this sign. Nutrition deficiency, for example, mother maybe have iodine deficiency because of the gout, greater. In vitro fertilization, and most of them is behavioral defect, obesity of the mother, defect on the neural tube defect, Hypoxia, for example, that's the mother living on the mountain, because the pressure of the oxygen is low. And the heavy metal, as I told you, that's organic mercury. CP, CP is a cerebral palsy. That's a bit tried like this. Lead, and as I told you, the male-mediated tracheogenesis. That was all factors for birth defect. But before the happen birth defect, we can diagnose it. We can screen it, the checkup of the mother. The one of them is maternal serum screening, alpha fetoprotein, that was made by the liver. And for example, increase of the alpha fetoprotein in a neural tube defect increase. Means with blood testing, we can check it, the alpha fetoprotein, HCG, estradiol, inhibin alpha. The next instrument for the checking is sonography. Ultrasonography. You know, this is so useful. We can use for the age of the embryo, yeah, by the CRL. And also, let me. Okay, for example, that's for the determination of the sex. That's a gap, for example. And let's say you can see the length of the CRL. Okay. And another one, and also after, you know, from until the 10 week, but some part of the book say that there's a difference between until the 7 week we can use for the age, and after that we can use the diameter of the parietal, the circumference of the abdomen, the circumference of the head, and the length of the femur or femur. We can use for the checking the embryo, and you know we have a Doppler sonography now. Doppler. This means the 3D sonography. Means you can see the face of the fetus inside the mother. Yeah? Maybe transvaginal or maybe from the abdomen. For example, you can see here there is a cleft. This is the normal. You can check the ear and the face, the nose and the eyes and the lips. Completely you can check it. For the structural defect, let's say you can see check the femur here, maybe check the hernia, okay? Check you can check the spina bifida, yeah? For the abnormal neural defect, abnormal or neural defect. Yeah, you can use that from the probe of the ultrasonography. Another thing is amniocentesis. Someone with the familiar Saudade families. Saudade.
Sobre?
No, means that that's what happened for the family. History. Family history have a Down syndrome. Yeah, but the Down syndrome maybe happen for all, but in they have a family history, it's possible. For the prevention of it, we can use a screening amniocentesis. We can pick up some amnion fluid, and there is in amnion fluid because some cell of the body of the embryo release into the amnion fluid. We can proliferate them and karyotype. If it's normal, that's normal. If it's Down syndrome, can abort it. Yeah, that's allowed to him because in some country, but in some let's say, have a contrast with the region. Here, but you know, it's I think it's in 6 months you can because it have to be. This is so dangerous. Okay, that's a needle maybe. That's goes to the body of the embryo and it's so harmful, and you have to check with the this probe of the sonography. But it is need to the skill of the operator. From the first of the session, you are taking this from the machine, but it's not good things. Why? Because inside the villus, we have a lot of abnormality. That's just one, but no recommend use this pressure, and it was all of this one. Would you like to explain for you the diaphragm, or you can see the film? The diaphragm that is the 7 week, we have, let me see. We'll finish this